Hi, my name is Wadne Auguste. I am the operations supervisor of the health education team. The health education team manages two different grants, the Retention and Adherence Program grant, as well as the Sexual Health grant.
My name is Ambrose Moses Calderon. I'm a health educator. I educate my patients so they could have those information so they could be healthy and they could live a better life.
Hi, I'm Kathleen Morris. I'm a health educator. My role is to educate patients on their sexual health, about testing, about PrEP, about PEP, and basically how to keep themselves and others safe with their sexual health.
Unity to me means working together towards a common goal with a shared understanding of values and objectives.
Unity to me means coming together, sharing ideas and information together so our patient could have optimum health. And with those shared goals, our patient could become whole.
Unity to me means working together with your team, along with everybody else that's associated with the patient's care. It could be working with social workers, the provider, the nurses. Everybody has to come together to understand what the patient needs and the way that we need to provide the patient with the best care possible.
My team works in collaboration with medical providers, social work team, dietitian, as well as the nurses. We are tasked with assisting patients with health literacy, overcoming stigma, as well as other housing instability that may impact their overall health care.
Our program have helped our community and our patients all together. But most of all, it have helped the patients to learn more about themselves, to learn more about the world that they are living in, and also this program have helped the patient become better. I have lots of time. I have patients who come to me and they tell me about their success stories. And I have numerous amounts of success stories with my patients that tell me that their family have become whole, that they themselves have become whole, and they are now living better lives.
What inspired me to get involved is my passion for sexual health and being able to make it a comfortable topic for our patients.
I love what Kathy said. I love educating people because when people get to know about themselves, they're able to understand themselves and they're able to help others also.
What inspired me was passion for caring for patients, caring for others. In addition to that, understanding that HIV affects about over 70% of, disproportionately affects 70% of Black and African American and Latino communities. And I felt that I had an impact by just getting involved and being able to educate patients on what they need to do to take better care of themselves.
My favorite thing about coming to work is that every day is very different. We get to educate patients on many different things, and some days it's about testing and PrEP and PEP and all these medications that we have. And other days it's simply just giving patients condoms.
Very good. apart from just coming to work and see my colleagues, my friends, in other words, I'll say friends, but coming to work means so much to me because you don't know what you will encounter with a patient. Maybe a patient might need food. Maybe a patient might want to know a place where they want to go and find a job. Maybe the patient might just want education on something, or just have a problem with their family member, and we're trying to work that through or get them through that process or that help. And this is one of my favorite times of coming to work.
Coming to work for me means the opportunity to make a difference in patients' lives. Never know what, you just being present for, in terms of helping bridge the gap between education of their diagnosis, being able to make effective referrals internally to make sure that the patient gets all of the resources that they need to receive, and being present makes that work.
And coming to work sometimes is so different. Every day is something different. Every day is something new. And you never know that, oh, well, I just have to come and work on a computer or something, but you will just get something new every single day. And that brings joy to you. One of the most memorable time of my working here is one of my patients came in with a foot problem, and the patient was limping. I'm holding a stick, and then I got him into the program. I call him like every other month, call him every week, because he was a new patient. And then with that, the patient started becoming better and better. He started taking his medication. His viral load came down. His T cells went up. And not only that, we directed him to help with the CD so he could get a job. And then he got an apartment. And after getting an apartment, he called me and said, "Oh no, Dad, I got an apartment. I'm living by myself, and now I could get my own food." And then also with that, he had issues with getting his papers. Then we help him out. The social worker and myself help him out. And after that, he got his papers. Then I worked with him on getting a resume put together. And then now we'll be working on interview techniques and those kind of stuff. And he's doing so much better from walking on a stick and walking upright, and then having nothing. And now he tells me about his family back home. His family is good, and now he's looking to bring his family over here. This is a great moment for me and a success story.
We have come a long way in terms of the falling rates of new HIV diagnosis. Our community continues to be impacted, however, by HIV. Our steps are to go out into the community, test as many people as possible, encourage people to come and test, as well as provide patient education on how to prevent new diagnoses. We work closely with getting our patients involved in their care as far as doing PrEP and PEP treatment, and as well as continuing to look at what are those social determinants of health that are facing our patients, as far as what are their barriers. Is it housing? Is it food? Is it a lack of education? Is it jobs? Whatever the barrier is, we need to come together, impact those barriers or control those barriers so that our patients have better outcomes.
HIV treatment have come a long way from patients taking multiple medication regimen from now to one medication regimen, and also we have Cabenuva, which people will just take a shot for once every other month, and now we are looking forward into once every 6 months. And with those medication, researchers have done multiple breakthrough on working on a cure. And I think we are very, very close in getting a cure, but we are still getting there. But we will get there.
So HIV has come a long way in terms of treatment and care. Patients are able to live a long, happy, healthy life as long as they're taking their medications properly and they're continuing the care that we've given them. But we do have a long way when it comes to stigma and discrimination, unfortunately.